So continuing on with sinus rhythms, the last lecture of this module, we're going to talk about sinus block, sinus pause, and sinus arrest. So as part of our objectives, we want to define all three, a block, a pause, and arrest. We're also going to analyze and describe the temporal differences between what constitutes a sinus block, sinus pause, and sinus arrest, and accurately identify sinus blocks, sinus pauses, and sinus arrest on a rhythm strip or ECG, and explain the clinical significance. So to start out with, a sinus block refers to a complete block or failure of the sinus node to capture or depolarize the atrial myocardium. It can last for 1, 2, or more cycles. The hallmark of a sinus block is that the pause is always an exact multiple of the normal P to P interval. So when you have the block, it will pick right back up in the P to P interval. This occurs because the sinus pacemaker is unaware of the block that is occurring farther down and continues to fire at its intrinsic firing rate. As a result, the underlying cadence of the rhythm remains unchanged. And so the underlying cadence is going to be a big deal and a big difference between some of these. So a sinus pause is a delay in the formation of a sinus impulse in the sinus node itself. It is represented on the rhythm strip as a longer pause between the complexes, prolonged P to P interval. And sinus pauses do not occur as exact multiples of the normal P to P interval because the delay usually occurs in the sinus node itself. When the sinus node returns after the pause, it may be set at the same rate as before the pause, or it may be a different rate. And then you have sinus arrest. A sinus arrest is caused by a longer delay in the formation of an atrial impulse. Sinus blocks can also be found within the pause of a sinus arrest, but it's very hard to determine that when you're trying to determine that off of just your basic ECG. On the ECG monitor, sinus arrest appears as a longer delay than with a sinus block. The delay causes a prolonged lengthening of the P to P interval, and sinus arrests are never an exact multiple of the normal P to P interval. There's no clear cutoff between a sinus pause and a sinus arrest, but for this class, we'll refer to anything that looks and follows the rules of sinus arrest as sinus arrest or sinus rhythm with arrest. So my rules. The rate's going to be variable depending on the frequency of the sinus arrest or pause. It's going to be irregular because you're going to have a disruption between the R to R intervals. The P wave should be before each QRS if it's present, and the P wave should be upright and uniform if the QRS is present. The length of the PR interval should be 0.12 to 0.20, and then the QRS complexes should all look alike and should be less than 0.12. So there's several things that can cause it. Sick sinus syndrome is one. It's not all inclusive on this list, but it does list a couple. A series of arrhythmias that are frequently seen in patients with diseased SA nodes for sick sinus syndrome. It can result in severe bradycardias, marked sinus arrhythmias, sinus blocks, sinus pauses, and sinus arrest. The diseased node can alternate between a very slow bradycardias and very fast tachycardias, sometimes called the tachybrady syndrome. Coronary artery disease or other effects on the myocardial tissue, hypersensitive carotid sinus syndrome, certain drugs such as digoxin, toxicity, myocarditis, some electrolyte disorders, and some other issues as well, or it could just be idiopathic and benign. So looking at a couple examples. So this first one here, if you notice, you've got a dropped complex right here, but it's in the exact multiple of the R to R. So this would actually be a sinus block. So the underlying rate would be a tachycardic rate, and so it would be called a sinus tachycardia with a sinus block. Same thing with this one as well, except you've got two missed beats here. So you've got multiples of the R to R, and so this is another example of a sinus block. So this patient here is not doing very well, as you can see from the underlying rhythm, but this patient has a very prolonged pause here. So it's safe to assume that this is a sinus rhythm with ST elevation that has a sinus arrest. So this is a sinus arrest right here. So if the patient's asymptomatic, medically stable, and they have episodes occurring occasionally, you may just observe them. If they're bradycardic and very symptomatic, then we will have to treat them using the sinus bradycardia algorithm, which ultimately, if they're very hemodynamically unstable, would lead to transcutaneous pacing.